Welcome back, everyone, to Midday Kentucky. Dr. Gina Johnson Higgins, DMD, which of course stands for dentist. How are you, my friend?
I am doing very well. How are you?
That's good. We love having you in here. And we're talking about sedation dentistry. Now, I call it sedation therapy. Is that the correct terminology?
Technically, we just say dentistry with sedation.
Okay.
Some people say sedation dentistry to differentiate it and make
okay.
it sound better.
A little fancier.
A little fancier. Everything's a little fancier. There are levels.
Let's talk about what sedation dentistry is to begin with and the different types of sedation.
Yes, let's
Because there was
talk.
a day that you just take a Valium. Back in the day, the doctor would just give you a Valium and say, see you in an hour.
Yes, and that can still happen.
Oh, okay.
There's happy gas.
Yes.
And, you know, a lot of people have been very happy on happy gas. There is oral sedation where you take a single tablet. You can take a tablet with happy gas. There's IV sedation. And then there are procedures where you actually go to a hospital and you have general sedation.
But that's like for root canals and things
well,
like that.
that would be for much more complicated procedures.
Really? Okay.
Yeah. Now, the sedation that I practice is conscious sedation. You're always breathing on your own.
In your office?
In my office.
Okay.
You do have to have a special license and a lot of special training to do IV sedation.
Okay. What would you be doing, what type of work would you be doing if I was to have that type of sedation?
For some people, it depends on their level of anxiety.
It could just be a clean.
Yes. We have people who are so phobic, they've had a bad experience, something went wrong. They don't want to know what we're doing, but they don't want to damage their health.
Yeah.
We sedate them for everything.
All right, Gina. Is it something that is part of insurance?
No.
So it's a cost on top of?
There is an added fee,
Okay.
and that fee is for materials, training, and safety.
Okay, good idea. Who benefits from sedation apart from people who are fearful? Are there any other uses for the sedation?
Well, people who have certain special needs benefit from sedation because their comprehension of the helpful procedures is diminished. So their fear level overcomes the helpfulness.
Thought of that.
It's very, very good for them.
Can
long
you
ones,
yes,
long procedures.
I was about to say that because you would try and do as much work as possible when you're under sedation.
Yes.
What about children? It's something I was thinking of as you were talking. Can children have sedation dentistry?
Children can have sedation dentistry with a pediatric dentist. Pediatric dentists should be doing, you know, sedation with children, but excluding happy gas or nitrous oxide.
Yes.
General dentists can use that for their pediatric patients. Anything beyond that, there is a special license requirement.
Okay, I can't have happy gas because all I do is laugh.
Is giggle.
Literally.
Can't
and
work
then
on
you can't, no.
Can't work on you.
You'd be like Troy C in a month.
You get none. You get the Valium.
I'm happy. What's the recovery time? Let's say I come in and have some teeth cleaning done, and I say, look, I can't handle this. I need to have the sedation.
For IV sedation, you are out that day and maybe part of the next day.
Really?
You're a little groggy. For nitrous, you know, happy gas, it is exhaled the same way that it goes in. So within about half an hour, you're back to yourself.
Wow.
So as I said, there are levels, and those levels should be discussed with your provider.
Right. So that's something when we come in and have our consultation with you, is that we say, look, these are our issues.
Yes.
You as the professionals say, okay, these are the types that we think you should have done, and then do the plan from there out.
Yes, and you have choices.
Yeah.
Some people just choose to be sedated. They're having veneers. They're, you know, a cosmetic procedure or a long procedure, 4 or 5 hours. They just don't want to know about it.
If you're working on my back of my teeth, I gag a lot, so I'd be happy.
Sedation would be wonderful for you.
That's what it is, my friend.
Perfect.
Dr. Gina, if you want to find out more information about this amazing dentist, all the information is up on your screen now. Phone number, email address, web address, it's all there. Or just pop on over. Guess what? They give you donuts before they clean your teeth.
And fruit.
And fruit and lots of water. There's all there. I think it's amazing. Someone put that comment up on your Facebook page, I noticed. Hey, up next.